You know, when Jamell had presented to us, we got a phone call actually from a physician that we know very well, a pulmonologist, and he basically said that I have a very young girl. You know, she's approximately 36 years old, and we had seen her actually a year and a half ago at that time, and so we knew that she had idiopathic pulmonary hypertension, and at that time she was on what's called life-saving medication, which is a continuous infusion drug where they're given a pump and an access port into their vein, and it's infused 24 hours a day. And because of that medication, she was doing extremely well. And at the time we saw her a year and a half ago, she was very functional, was able to walk around, take care of her kids. And then, unfortunately, about 2 months before we got the phone call, she had said that she's noticing she was getting more short of breath and probably had some sort of viral syndrome. And usually you can break out of that, but in her case, she started to develop multiple organ failure.
I don't remember much the last week at the other hospital. I guess my kidneys and liver are shut down. And my doctor said it was time to call transplant. I remember him saying that. And then a couple hours later, yes, Dr. Hodges and Saggar showed up and decided to bring me over here, try to get me better, because I was too sick to get transplanted at the time. So they needed to get me better. And they put me on a special dialysis machine that only takes off water. And I think they took about 14 pounds off in a couple days of fluid. And then I started to get better, and my kidneys came back. They didn't know if they were going to come back or not. So, and my kidneys came back, and I started getting better. And so then they approved me for the transplant, and then that took 9 days. And they took me back and transplanted me, and I had some issues with the medication putting me under. I have a high tolerance, so they really had to drug me up. And I had wild dreams, and I guess I was out for, I don't know how long I was under for, I think 5 or 6 days, but I guess I pulled out my intubation and then they ended up putting a trach in me. And so that took a few weeks for me to get off the trach, and they sent me up to the 6th floor for 2 days, and then over to rehab, and I was there for 2 weeks. I feel really good. It's hard. I have to retrain myself how to breathe, because before I breathe through my shoulders, and now I gotta learn how to use my stomach again. My stats are really good, and I feel great. I'm getting stronger every day. Awesome. I can't believe that the nurses, even when I was in rehab, nurses from ICU would go over there and see me. And the respiratory therapist, Anna, she was constantly coming and checking on me. I couldn't ask for better staff. And the doctors, I feel like I had my own doctor house. You know, they remembered things that I said from last January when I came in for a consultation, which amazed me because they were just little details. Just going on a bike ride with my kids, going hiking, swimming in the ocean, just everything. Going up north, before I couldn't go up to high elevations because I couldn't breathe, and so I just want to enjoy outdoors.